Welcome everyone. Today we will be covering Chapter 6, Child Maltreatment. These are the learning objectives for this chapter. By the end, you will be able to define the 4 types of child maltreatment, identify risk factors, discuss protective factors and prevention strategies, list signs of each type, and explain mandated reporting and who it applies to. Children under 1 year old had the highest victimization rate. These numbers, based on 2017 data, remind us why this topic is so critical for early childhood educators. There are 4 types of child maltreatment. Physical abuse is non-accidental physical injury caused by a parent or caregiver. Sexual abuse is any sexual exploitation or contact involving a child. Emotional abuse is a pattern of behavior that damages a child's emotional development. Neglect is the failure to provide for a child's basic physical, medical, educational, or emotional needs. All 4 types are serious and can have lasting effects on a child. A child experiencing physical abuse may have unexplained bruises, burns, or broken bones, and may seem fearful of caregivers. Signs of sexual abuse can include difficulty walking, unusual sexual knowledge for their age, nightmares, or running away. Emotional abuse may show up as extreme behaviors, developmental delays, depression, or withdrawal. Neglect may be visible through frequent absences, begging for food, lacking appropriate clothing, or poor hygiene. Always take these signs seriously and document what you observe. In children, watch for sudden changes in behavior or school performance, being overly watchful or anxious, not wanting to go home, or being reluctant to be around a particular person. Sometimes a child may directly disclose maltreatment. In parents or caregivers, warning signs include blaming the child for problems, demanding unrealistic performance, showing little concern for the child, or requesting harsh physical discipline. These signs do not confirm abuse, but they should always be taken seriously. Abusive head trauma is a severe and preventable form of abuse caused by violently shaking or hitting a baby's head. It is most common in children under age 5, and at least 1 in 4 babies who experience AHT dies. Survivors often face serious long-term consequences like brain damage, vision loss, and developmental delays. AHT often happens when a caregiver becomes frustrated with a crying baby. Remember, crying is normal infant behavior. Never, under any circumstances, shake a baby. At the individual level, children under age 4 and children with special needs are at greater risk. Caregivers who struggle with substance abuse, mental health issues, or financial stress are also at higher risk. At the family level, social isolation, intimate partner violence, and poor parent-child relationships increase the risk. At the community level, factors like poverty, unemployment, and community violence all play a role. It is important to remember that risk factors do not cause abuse, but they can help us identify families who may need additional support. Protective factors can help prevent maltreatment from occurring. At the family level, having a supportive environment, nurturing parenting skills, stable relationships, and access to healthcare and social services all make a difference. At the community level, caring adults outside the family, role models, and communities that actively support families can reduce the risk of maltreatment. As an early childhood educator in California, you are a mandated reporter. That means you are legally required to report all known or suspected cases of child abuse or neglect. You do not need proof. Only reasonable suspicion is enough. You must report directly to local law enforcement or county child protective services. Reporting to your supervisor does not fulfill your legal obligation. Failing to report is a misdemeanor, punishable by up to 6 months in jail and a $1,000 fine. Remember, reporting is not an accusation. It is a request for investigation and help. Children who have experienced abuse or neglect need caring, supportive adults around them. You can help by making children feel safe, supporting stable relationships in their lives, and referring them to trauma-informed services. A child's ability to cope and thrive after trauma is called resilience. With the right support, children can heal. Thanks for watching.